Welcome back, everybody. It's right now 10 minutes past 11 at midday. And of course, sooner or later, we all need health care coverage in some form. This week, though, you have the opportunity to talk about some of the most urgent and important health care issues affecting our community. Joining us right now, we have, related to the Health Equity Symposium, Dr. Karen Frith. She is the Dean of the College of Nursing, over at University of Alabama, Huntsville. And I guess my first question to you is, we hear the word symposium. Tell us about this event.
Yes, thank you. So the College of Nursing will be hosting a Health Equity Symposium, and the goal of this symposium is to bring community members together to find things that are important to this community. So we'll begin the day with an overview, a keynote speak by Mr. Kenny Anderson, well known to this community for his work in the community to bring about change. And will be followed by Mr. Daniel Casambira of United Way of Madison County to give us a report on the community needs assessment that has been finished. And Dr. Jennifer Bell from UAH will talk about a health equity index that we would love for our community to participate in so that we know where the services and gaps in services are as well. The topics that we'll be focusing in will be cognitive health across the lifespan, the healthcare needs of individuals with careers in service, such as veterans, first responders, and of course nurses. And the last topic is cancer prevention, survivorship, and supportive care. These areas are all concerns in this community that bubbled up from a previous health equity summit of community leaders in May of 2024, and this is a follow-up.
I was going to ask you, so people tend to think healthcare that, the needs of one community are the same in the next community, and that doesn't sound like that's the case. Every community, every city may have its own unique health needs.
Yes, that's exactly right. And so here in Huntsville, we know we have adults who have cognitive impairment, either from stroke or the effects of chemotherapy after treatment for cancer or dementia. But we also have a large number of members of our community who have autism and diagnosed as children, but then later need to have supportive care so they can live independently. And again, the same with adults with intellectual disabilities. So that's an important distinction about this, this community. About 1 in 35 children will be diagnosed with autism in this community. It's much higher than the national average.
We mentioned veterans and first responders. Not only do they provide an urgent service for all of us, but they also require some very unique care based on some different things that they encounter that most of us don't.
That's right. And one of the things that is a national initiative from the nursing community is a question that's asked of every person who's admitted into a hospital or seen in clinic settings, and that is, have you ever served? This question is terribly important because there are risk factors that soldiers and other military members have been exposed to. And so to ask that question, then we know to have follow-up about their risk for cancer or other conditions. Same with our first responders. They're at increased risk of cardiovascular conditions and nurses as well because the shift work. We know that our first responders and nurses work 24 hours a day, 7 days a week. And so those night shifts certainly affect their health.
It does. And thank you for being so adamant at making sure that we address these concerns in our community as they are unique to our community.
Thank you.
This is Dr. Karen Frith with us today, and we thank you so much for joining us. I want to remind you, the Health Equity Symposium is this Thursday, November 14th. Starts at 9 in the morning, ends at 3 that afternoon. It's happening on the UAH campus at the College of Nursing.
Yes, that is correct.
And it is open to everybody, so you might learn something if you stop by. We'll be right back.